The UK continues to race ahead with its vaccine rollout. We've ordered over 400 million doses and we're getting them into people's arms much quicker than many other countries too. But the future here still relies, of course, on what happens elsewhere in the world. So let's speak now to our first guest, the WHO's Special Envoy on COVID-19, Dr. David Nabarro. Thank you very much for being on the programme this morning.
Good morning.
How concerned are you about vaccine nationalism?
Well, the situation is that we have some excellent vaccines that can stop people from dying. These vaccines can prevent health services from being overloaded, and they are a fantastic invention. The world should be accessing these vaccines in an equal way because right now, health workers everywhere are at risk. Older people also are at risk. And the only way to deal with a global pandemic is to get fair shares across the world now. That's the right thing to do. And I'm really hopeful that world leaders in the coming weeks will realise that to have a few countries vaccinating a lot of people and then poorer countries having very limited vaccines is not really the way to go ahead, economically, socially, environmentally, and indeed morally.
You're talking about countries getting their fair share of vaccines now.
Yes.
Of course, many countries have got no vaccines. They haven't vaccinated anyone so far. The UK, by contrast, has got 400 million doses on order.
Yeah.
Is that something to be proud of, or is that actually quite selfish?
Well, it's totally understandable. Nobody in the World Health Organization wants to say that people should not be vaccinated if there is sufficient available. It's just that at the moment we're in a world that has quite a shortage of vaccines compared with need, and it will stay like that for some months. We've also established a scheme that enables all countries to share in the vaccines that are available. They've asked us to set it up. It's been set up. It's called COVAX. Over the next 6 months, I'm hopeful that all world leaders will commit to a fair sharing arrangement after we've gone through the present period of competition to get as many people as vaccinated as possible. In the end, it's one virus affecting the whole world. We're all at risk. We need to deal with it as a single issue.
I think, if you say things like, everyone deserves a fair share, no one would really disagree with that. I'm interested in what it actually means in practice. So at what point do you think the UK should look to potentially sharing out vaccines with other countries, and who should we prioritise?
The priority for vaccines at the moment everywhere is people who are most at risk of getting severely ill or dying from this disease. Those are people who are susceptible because of their age or because they've got other conditions. They're people who are highly exposed, for example, because they work in healthcare. That's the same situation everywhere. And we need a global policy to do that, which is perfectly feasible. What matters is at the moment that politicians believe that their primary duty is to make sure that they get vaccines to perhaps everybody in their countries. We think that citizens can actually perhaps talk to their politicians and say, hang on a bit, we're actually part of the world. And we think the first priority is to make sure that everybody everywhere gets what they need. We set up a scheme, as I said, called COVAX. 100 countries are ready to receive vaccines. They've gone through preparatory processes. We've got money to be able to buy vaccines for them. We're actually authorising the vaccines as quickly as we can. It's a longer process for the WHO than for national governments. And we just
just to jump in, I'm quite keen to clarify, you're talking about the priority to vaccinate the vulnerable, but then potentially to look elsewhere. Does that mean then that do you think that once the UK has, for example, vaccinated those most at risk, people over 50, then that's when we should start giving vaccines to other countries?
I think we should. Of course, each Prime Minister, each group of MPs has to form their own decisions. But it's really a question of what makes sense economically, what makes sense for society, and how we all want to be remembered in 10 or 20 years' time. Do we want to be remembered as a world where those who had the cash could afford to vaccinate their whole populations, and countries that didn't have the cash had to cope with a possibly quite dramatically increasing death rate among their health workers? I don't think so. I don't think that's how any individual really wants to be seen when they look at themselves over the years. And it's going to be time, I think, for a national and perhaps even global debate about what the priorities should be, because in the end, we are human, and humans need to be able to work with each other, whatever their race, whatever their ethnicity, whatever their wealth.
Talking about the global response to COVID, the fact that no one's safe until everyone is safe, the economic damage you talk about, is it sensible to limit travel at the minute, particularly, of course, given the new variants? And if that happens, do we need to take a blanket approach rather than just having certain countries on a red list?
I think the main thing about dealing with COVID right now is what we do inside our communities and inside our countries. There are two things that really matter. The first is to do everything we possibly can to avoid getting the virus and spreading it. And we know what we have to do: be 2 meters away from each other, wear masks, isolate when we're sick, and of course, practice very good hygiene. And now we've got the extra advantage of vaccines, which will save lives and also protect health services. But we also need really strong community level, locally led public health services, what in Britain is called test, trace, treat and isolate. But that needs to be really well working, because you can't deal with this pandemic without being able to stop spread. And then once those are in place, we will continue to see the numbers going down. Last point from me. Yeah.
Do you think the UK's test and trace programme is working at the minute?
Well, I think it needs to do better. I think all countries need to get their test, trace, treat, isolate programs working really well with strong local support. You see, you can't do this kind of work of contact tracing and transmission interruption if you just do it centrally. You've got to get locally with central support. Last point on this one is I just want to say how brilliantly people are doing throughout the world at the moment on this pandemic. Look at how numbers are coming down in different parts of Europe, in the US right now. They're coming down because of people's actions, because of the actions of health personnel. And I think we just have to sometimes stop for a bit and say, we are doing amazingly. We've got to go on. We can't stop. We've got vaccines to help us. But in the end, it's our self-discipline that's going to get this pandemic well contained.
It is quite incredible, really, when you think about it.
Yes.
The sort of restrictions that we've all been living under for the last year or so,
Amazing.
No one would have imagined it just a short time ago. Absolutely extraordinary.
Amazing.
I'm keen to talk a bit about the vaccines as well. There's a report in the Financial Times this morning about a study of 2,000 people, which seems to suggest the Oxford AstraZeneca vaccine is less effective against the South African variant. It has limited efficacy in protecting against mild and moderate disease, although important to note that nobody seemed to get severely ill or died. Have you seen the study? And are you concerned by it?
Well, I saw the press cutting that you're referring to. And yes, this virus, like every other virus, will vary. A bit like you and me, we look different. And we and other people look different, so we have variations. And some of those variations are going to be more viable than others. So, yes, we're going to see variations emerge that are particularly dangerous from time to time. We know how to deal with this kind of problem. The first thing is that we use the same precautions as we're using more generally with regard to distancing and face masking and so on. Secondly, we can adapt vaccines. The scientists are good at doing that, and we will do it. Just like we do for flu, we'll do the same for coronavirus. So, yes, variations are worrying, and we have to be very conscious of them. But we know they're going to come, and they're going to go on coming. And we know that the vaccines will continue to have to be modified. And that's as it will be. The really important thing is that leaders all over the world need to give support to outfits like the World Health Organization, which is the only kind of organization that can keep a track on variants as they emerge in different places and can help with advice on things like travel. Each country will have to work out its own travel rules. That has to be based on their understanding of the danger. But in the end, it's what we do inside our countries that will determine whether or not we can keep this virus contained and under control.
The UK took a bit of a risk, didn't it, in delaying the dose between two vaccines against the advice of the WHO. According to the Joint Committee of Vaccination and Immunisation, the data so far shows actually quite high levels of protection after the first dose, undoubtedly saving lives, they think. Has the UK's approach been vindicated?
Well, certainly what's happening with this virus is we're learning all the time. The World Health Organization's advice on intervals between vaccine doses was based on what the manufacturer did in doing the what we call phase 3 trials of the vaccine. And then WHO and its committees really has to work on the basis of what manufacturers have told them. But isn't it wonderful that it has turned out, as a result of the UK's bravery, frankly, that this extended interval seems to be associated with even greater protection? That's how we're doing COVID at the moment. We're all learning together. Different countries are approaching it in different ways. And within WHO, talking with experts from the UK, we're really, I think, benefiting from the willingness of UK scientists and UK leaders to tell us very precisely what they're doing differently and why they're doing differently. And then we add it all up and we learn from it. So, yes, I think the UK's approach, so far at least, has been vindicated. And yes, I think this is a great lesson for the rest of the world. Thank you. Thank you, British scientists.
Yeah, incredible what the scientists have been doing, absolutely. Do you think the WHO could actually change its advice then on the spacing of the jabs?
Well, that depends not so much on WHO Secretariat, the people who work in the headquarters and in the regional offices. It depends on the committee of experts, some of them British, that advise the WHO. That committee is meeting pretty often at the moment because there's lots of vaccines coming on stream, and the committee has to look at the vaccines, and it will indeed look again at the dose issue as a result of the British experience. That's great. And there's more going to come through about these vaccines over the coming weeks and months. And we, as I say, will benefit hugely from what different countries are doing. We've never had this speed of advancement, sort of doing and learning at the same time in my professional life in anything like this way.
Yeah, it's been quite awe-inspiring, really, the speed of it all. The WHO is carrying out an investigation into how COVID started in China, visiting sites, the wet market, for example, the Wuhan Institute of Virology. Has the WHO received full cooperation from the Chinese?
The situation, as I'm being told, is that the cooperation has been exemplary. The visit was carefully planned. All the sites that WHO people wanted to visit are being visited. There is openness for all kinds of communications to take place, and the work is going ahead, I think, pretty well. But it's early days. This is detective work, and those of you viewers who study how detectives work will understand that you're looking at lots of different leads and you're trying to pull together different bundles of evidence. We're anticipating that this will take quite a lot longer. I've been involved in studies of earlier jumps of viruses from animals or birds to humans. It's never clean and easy. There's never a little signpost saying, follow this path. You have to really work it out. And so what I'm going to say is great cooperation and good results so far, but it may take quite a lot longer to get the answer.
Just finally, talking about the detective work, can you rule out the theory that the virus may have escaped from the lab in Wuhan?
Well, the thing about theories is that you have to have them as a way to set up where the reason why things might be occurring in a particular way. There will be theories about how this virus originated, including what we call a laboratory incident, and that has to be assessed. I can't rule anything out, and I know the team on the spot, as well as those they're talking to in China, they're not ruling anything out either. All options are on the table, and everything will be looked at.